Further debate? I recognize the member for Oshawa.
Thank you very much, Speaker, and I'm very pleased to be able to stand and put a few remarks on the bill or on the in debate today for G269, Protecting the People of Ontario Act, the Budget Measures Act. Speaker, for a very long time leading up to the budget, our offices were hearing from agencies, hearing from organizations, hearing from folks who are extremely concerned about how challenging it is to get by in the province right now. There have been specific concerns brought to our offices about programs like the small business grants and how that is unrolling and unfolding, the challenges there. We've seen emails just by the truckload about money spent in healthcare, the need for a comprehensive vaccine strategy. People are very concerned about the health and wellness of their loved ones. Parents very concerned about what the state of public education not only looks like now, but will look like in future. So, Speaker, all of those pieces I'm bringing into the legislature today to be able to share some of their stories, to get some of their concerns on the record, because, Speaker, this budget, frankly, was a missed opportunity. You know, and I know we're going to have a lively debate. I'm certain. I know that the government is going to, hold up some of the investments that they're making. They're going to talk about their priorities, and I'm very glad to hear about the few things that they have listened to from the community. Speaker, I'm going to take this opportunity to congratulate the fine folks at Grandview Kids. Grandview Children's Centre has been in my riding of Oshawa for a long time, doing remarkable work. They have been lifting families with children with special needs. They have been helping them to navigate, this, not just the province but the world. The hopeful stories of success from Grandview Kids is just remarkable, and I know that that is something that the government members and I have in common, is that we have all been working alongside Grandview Children's Centre to secure funding, new building. It has been quite a journey, and it's been a journey of the heart. And so, Speaker, I wanted to congratulate the folks at Grandview Kids, their board, all of the folks, Lorraine Sundstrom-Mann, who's the CEO, and I've been very proud to work alongside them for so many years. And I will say that while I'm excited about the new build, I'm excited about their new journey, their new chapter in Ajax. Right now, they're right up the street from me, Speaker, in Oshawa, and I'm going to miss them. So I wish them well, and I am pleased to see their hard work reflected in investment. So I congratulate them, and I wish them many, many years of continued success supporting and strengthening and inspiring children across our communities. And, Speaker, that's a good news story, but I don't have too many more. As I said, it's a budget of missed opportunity, and I think that this budget really does rob people of the hope that they had, imagining what could be reflected of their needs in this budget. So, when the NDP forms government at our next opportunity, we would ensure that our priorities were reflected in the spending and the plans as a government. But today, I'm going to have to. It's going to have to be enough to tell the government what we would have done. But some of the members on the other side will come back after the next election. Some of them won't, but they can watch from home about how we invest in the communities. So in this case, we would have invested in long-term care and hiring 10,000 PSWs this year, giving them a raise. Speaker, it's not enough to call folks heroes. It isn't. It's not enough to thank them. You do have to invest in their health and wellness. You have to start to see this essential work that we talk so much about, and it has been brought to the fore really clearly during the pandemic. We all now know how vital it is many of these roles across the community, how important they are, how they keep us moving forward. So, Speaker, when it comes to personal support workers, whether that's in long-term care, congregate care, like all through our community, we have personal support workers. And just this morning, my colleague from Sudbury had his private members bill vote, and I was proud to vote for it. And it was Bill 266, and it was, respecting a minimum wage, minimums for support workers, and I was proud to vote for it. And I wonder if the government members, if any of them were proud to vote for it. How did it turn out, folks? No, that's what I thought. So it did not pass. So we can call them heroes, but we won't pay them to be heroes. So actually, it's an awful part of this, because it isn't just not respecting the work of the personal support workers. We should have been hiring them. You know, when other jurisdictions were prioritizing health and safety so that we could get through this pandemic. Not this government, right? They had other plans. They have the Just Trust Us plan, and I don't tend to, Speaker. I'm not a trusting sort, but it's the best predictor of future behavior is past behavior, and so we haven't seen that there has been a strategy that has kept people safe and well. Speaker, gosh, there's so many notes here. I wanted to say that some of the things that are missing, we wanted that comprehensive investment and plan for vaccines. I stood up this morning and asked a question specific to Durham Region, but I've been hearing it echoed across communities with my colleagues. Everyone wants to ensure that their community members have access to vaccines, and that's going to require investment all the way along, right? The mobile vaccination, like mobile vaccines, what could that look like for folks? I mean, I realize that this has been a piecemeal, kind of convoluted rollout, but it didn't need to be. We have been anticipating the vaccines a long time. I have heard, the government's answer about the supply challenges, but the distribution of it, we need to make sure is seamless. And again, we haven't seen that. Education and childcare. I'd like to talk a little bit about that because, again, we've talked about the SHE session, that we're going to need a SHE recovery. And, often when we speak about women in the workforce, we also have that connected conversation around childcare. And this government is going to have to pull up its socks and really, invest to ensure that women are part of that SHE recovery. And again, it's been not enough. Like that's sort of the theme of this budget. And if not now, when? We are in a pandemic that keeps going and keeps going. And, we all know that there will come a time when this is something we remember. But we're not there yet. And so we should be seeing, investment and support now. But we aren't seeing the commitment to replenish school board reserves. And this was a government that said, thou shalt spend the money you have in reserve to the boards. But they do need that money to, to build, to support learning needs going forward, and there is no money in this budget to replenish those supplies. The keeping schools safe, the section in the budget, it just recaps this year's spending, including federal dollars, board reserve funds, but there isn't new money for example, ventilation systems. There's certainly no mention of increased staffing to reduce class sizes. And, Speaker, if we're not seeing, the funding for COVID, if we're not seeing that at least remain stable or increase, where does that leave us? I know that there are, I think it's 4 schools in Durham, 4 schools in Oshawa. One for sure that is awfully personal to me, and that's Glen Street Public School. That was where I was teaching when I had to stop and run in an election, Speaker. So those are my kids. That's my neighborhood. And to know that they have had to close, that public health closed them for at least 2 weeks because of COVID in the school, rampant COVID in the school, and really has been a challenging situation leading up to that decision. I'd like to see schools like that get the support that it needs. So jobs and business supports. Now, Speaker, it's going to take me a minute to find it, but I got a letter, I think it was today. This may take me a second. I walked in here and I got up so quickly because I was so excited to speak about the budget. Darn it, I can't get my hands on it. But I got a letter from the IPS Action Centre, and that's the Independent Parts Supplier Action Centre that was actually the very last public event that I went to before kind of the pandemic realities really set in, and we cut a ribbon. I was there with some of the ministers for the IPS Action Centre, and in the wake of GM's original decision, this was set up to help those workers find their next steps and move forward in an uncertain future, and to try and give them the tools that they needed, connect them, resume support, job support. But I got a letter from them from 222, Unifor 222, and voices in the community sounding the alarm, and it was sent, I was copied on it, but it was sent to this provincial government as well as the federal government, asking for supports, asking for commitment from both levels of government to stand by them as they are, as GM is staying in our community, or we've got a future with GM in Oshawa, which is great, but their concern as the parts suppliers is they want those assurances that the jobs will stay in the community. So, while that isn't something that is in the budget, I want to see that kind of economic support, the job supports for communities, that we have an opportunity in Oshawa to keep those jobs there, to apply that pressure to, in this case, to General Motors, but to remind them that we're all interconnected in our community and we need that kind of support. So again, this is a focused strategy that we're needing from the government in Oshawa. A few things that are missing that would also help people when it comes to the workforce and a strong economic future that we don't see in this bill, disappointingly, because we've been talking about it a lot, is the need for paid sick days. When the government likes to point to, a federal program that is not what is, it's not a provincial paid sick day program. People have been calling for it because it's what is needed. It's not just the NDP pulling words out of the sky. It's been asked for by workers. We would like to see paid vaccination time as well. So if workers are having to make difficult and impossible choices right now, that if they are sick or they've been told to stay home to self-isolate, and they know that those days off work are unpaid, if they know that they will not be able to pay their rent, if those couple of days that they have to stay home means that they can't pay their rent, that they then might get evicted. Those are tough choices. Why on earth would anybody, they can't make that choice, so they're likely to go to work sick. And we've seen what community spread looks like. We're seeing it now. We're seeing the numbers rise. But vaccination time matters too as we get into the next chapter of this and more people are looking for that opportunity to get vaccinated. Again, this is something that money is involved, and we were hoping to see that from this government. Speaker, I'd like to speak a bit about the Small Business Support Grant. So this is a program that unfortunately we haven't seen expanded eligibility in this budget for the Ontario Small Business Support Grant. The eligibility hasn't changed, so some businesses that were not successful that they applied and they weren't successful in getting this grant, dry cleaners or breweries, etc. If they didn't qualify the first time around, too bad, so sad. They can't. There will be no additional funding. But Speaker, we're hearing all sorts of interesting things. I've got a gentleman in my riding who has 2 businesses. And he was told that he would have to pick one. Imagine picking one of your businesses to receive a significant grant and be able to continue, and having to pick one that is now going to flounder and potentially no longer exist. How do you pick among your 2 businesses? Now, because he's being told he can choose whichever of the 2, that would tell me, Speaker, that they would both indeed qualify. So had he been 2 people, both of those businesses would have been successful and would have received this funding. How is that fair? And there's no appeal process. There's no appeal process. And there are a lot of other, complicated stories that we're hearing across our ridings. Like, we've all got businesses that either just missed out based on some technicality, or like this gentleman I just talked about, that he has 2 businesses. He's got to pick a favorite. That's unbelievable. I also heard from Sarah. Sarah is a hairdresser, and again, she has been playing this game with them since January 19th. So she applied for the small business grant on January 19th. Something about the formal name or what have you in the paperwork meant that there was a challenge to actually receiving the payment. But she is qualified. Well, they haven't had any money, and they haven't had any money. That check just the money has not come. And I don't mean to laugh. It's remarkable that there are so many businesses right now that have been told that they will receive the money, that they have been successful in their grant application, and they still haven't gotten any of it. People wondering if the money's been deposited in the wrong account. I spoke to someone, Candy, from a salon called Hair Candy, and she's been waiting. She is a successful applicant, and she's very grateful, for that. But now where's the money? And the wolves are knocking. She's got a lot of creditors saying, okay, you've told us the money's coming. When? And she can't answer them and she's been working with our office, and when we reach out to the ministry, we're told send them to this email. Well, that's the one that they've already emailed, and our office is in that same loop of trying to get a call back or trying to support people. Because being an MPP, it used to be that you could pick up the phone and somebody would answer your questions, but ministry to ministry, it depends now. The Premier got away with the landlines and was so excited about that, but what that means is none of your ministries have to return our calls because we can't call, and often we don't have the exact person, which is its own challenge. I've mentioned those businesses. We're starting to keep track of them, though, so we're happy to share that with the government on the other side. Speaker, when it comes to social assistance, income support, we haven't seen what people need, which is disappointing. Speaker, I don't have to tell you that in this budget there was no mention of poverty. So if there's no mention of it, then there isn't a solution. And certainly in Oshawa, we are struggling and in desperate need of anti-poverty initiatives, homelessness, investment, anti-homeless. The homeless community is really struggling. We want more strength on the other side and purpose when it comes to addictions, opioid strategies. There's no mention of any support for children with autism. And my colleague from Windsor West got up this morning and asked, an excellent, very specific question about, folks and families in congregate care and their needs. We shouldn't have to ask. It should be in this budget. You're supposed to be working with the same constituents that we are, answering the phones and their emails and addressing their concerns. Transit, transportation, infrastructure. I feel like I've been having the opportunity to speak a lot about that. Disappointed that I didn't see the GO train to Bowmanville in this particular budget, but hopefully the wheels are still turning in that direction. It's always nice that when we see it in writing, so hopefully that is coming. But again, Speaker, you can see I've got pages and pages in front of me, and I know the government has just buckets of emails and concerns from their own constituents. And while you missed the boat on this budget for some of them, hopefully it's not too late and you will indeed start the kind of investment that has to happen, because we want a budget that will give people help, that will give people hope. But we're going to keep fighting against their cuts and have a positive vision. We hope the government will share it with us. Thank you, Speaker.
Thank you very much. Questions? The member from Whitby.
Well, thank you, Speaker, and I thank the member for Oshawa for her presentation. Speaker, you will know that in the Ontario budget, we increased the budget of the Ministry of Seniors and Accessibility. And more recently, I spoke about the investment of $4.5 million to the Ability Centre, added on to overall, that's a global investment of $6 million. My question to the member from Oshawa, will she be supporting this unprecedented investment in helping Durham residents of all abilities? Thank you.
You back to the member from Oshawa for a response.
Thank you. And actually, I am glad to have a bit of a chance to do a back and forth with the member from Whitby, because I know that, and he will know, that we have stood alongside the folks at Grandview Children's Centre, and as I congratulated them for their hard work through the years, continues. You know, the last government, this government is recognizing the needs there. The Ability Centre in Whitby is a very special heart of the Durham community. And again, these are community centres and spaces that deserve to be funded, that do tremendous work across communities with families. And we want to make sure, though, that while parents are appreciating that services may be able to continue in one regard, they also are parents of children with special needs that are looking for other services and supports
Response?
that they aren't finding elsewhere in this budget. So that is something that it's the big, ribbon cutting moment is one thing, but it's all of the other small pieces too. Thank you.
Thank you. Further questions? The member from
I'm not going to help you.
Muskegowuk, James Bay.
Thank you, Mr. Speaker. Merci pour ton allocution.
Thank you for your speech.
No, on your speech of 269, you spoke about poverty, and if that's something that touches us all, is in all Ontario, is poverty. And in Muskegowuk, we spoke about lack of homes. Homes built for 6, and there's 2 or 3 generations living in these small homes. And we also heard just this week or last week, our colleague from Spadina, Fort York, with a motion on homelessness. And you did speak of poverty. I'd like to hear your perspective.
Question?
What do you think should be in this bill, on this budget bill, to cover homelessness and poverty?
Thank you. To the member from Oshawa for response.
Thank you very much. And while the member from Muskegowuk, James Bay, can't see my 2 desks here covered in letters, there's one of them here from Cassandra, and I look forward to sharing it later in today's debate, that is exactly what you talked about. The challenges, not only finding a home, but keeping the one she's got in the middle of evictions and dealing with poverty. So many people have a story, but when you walk around Oshawa and you see a homeless circumstances, like it's gut-wrenching in my riding and your riding. Some of the things that need to be seen, we need an increase. And we've been saying this since long before the pandemic, folks. There needs to be an increase in ODSP and OW supports for people. The government has sort of their pat taglines that they like to say, but these are people's lives.
Response?
They need money they can count on. They need compassion to go with compensation, and just money to get by and make plans and participate in their communities where they do indeed belong, despite this government's.
Thank you.
Thank you.
Further questions? The member from Milton.
Milton. Thank you, Mr. Speaker. Mr. Speaker, I want to thank the member opposite for her speech. Mr. Speaker, one of the concerns that I hear regularly in my riding and heard loud and clear during the last election campaign in Milton was the issue of broadband. It's a serious issue, especially for my constituents that live in a rural part of Milton. Milton is part of the GTA, as we all know, but can you believe that even in ridings like Milton that are literally part of the GTA, there isn't a broadband internet service available for constituents, for farmers, for small business owners, and especially highlighted by this pandemic. Mr. Speaker, there are students that are obviously having a hard time trying to go online, trying to study, farmers, small business, and so forth. So our government has made previously a $1 billion historic investment, and in this budget, there's an additional $3 billion to address gaps when it comes to internet service throughout this province. So I'm wondering if the member can tell us if the member thinks that is a good investment for Ontarians' broadband service.
Thank you. To the member from Oshawa for a response.
Thank you very much. I am so excited every time I get the chance to stand up and talk about Bill 257, and I bet I'm going to have the chance later this afternoon, Speaker, or tomorrow, who knows, but I'm ready. I've spent the last few days in committee with Bill 257, which is the so-called broadband bill, and I say so-called because Schedules 1 and 2, which we proudly supported at committee, deal with the expansion of broadband, which is needed, no questions. Schedule 3 of that bill, though, the government wants to celebrate that investment, but then throws in Schedule 3 that gives like phenomenal cosmic powers to one minister to be able to sort of supercharge their MZOs to do damage and harm and kind of make a mess of things. So, again, with this government, with the one hand they're talking about broadband, and with the other they're beating down the future of the province. So it's a tough one to answer that clearly. The clear answer is we support broadband. We need communities all across. We need the unserved, underserved, last mile communities to be a priority. I don't know why the government wouldn't accept that amendment and prioritize in writing those communities that are
Thank you very much.
Thanks.
Further questions? The member from Scarborough Southwest.
Thank you, Speaker. I want to thank the member from Oshawa for her very well-researched statements. And my question is related to what you mentioned, what the member mentioned about her riding in Oshawa and the amount of vaccines that were allocated. Over the past months and months, one of the things I have been talking about is the allocation of vaccines to Scarborough in my riding of Scarborough Southwest, which hasn't been enough. Today we found out there's over 700,000 vaccines that are sitting in the freezers. Meanwhile, our allocation went down by about 77%. So I just wanted to ask the member to reflect on that and talk about how it's been for her riding and what the government could have done to make sure that there is a better equitable distribution of vaccines, Mr. Speaker.
To the member from Oshawa for a response.
Thank you. I also took the opportunity today during question period to ask the minister about vaccines. In Durham Region, we are it's a dubious honor, being at the top of the list for number of cases per capita in the province. We're number 5 now. A lot of concerns. My office is being flooded with concerns about how to access the vaccine, what that can look like for different people who have children with chronic illness. The parents are wondering if they are allowed to get vaccinated to keep the kids safe. I mean, everyone has a specific question. And part of it has been a challenge because this has been such a tangled rollout. I applaud our local public health and the hospital who are kind of working to get the vaccines into arms. But it's been a piecemeal system. I would ask that the government, they should have invested in it all the way along and been ready for it, for crying out loud. Thank you.
Thank you very much. Further questions? A member from Mississauga Centre.
Thank you so much, Speaker. And I was listening intently to the member, and I have to say I have great respect for the member. However, listening to her, I had to wonder whether we are reading the same budget document, because our budget, Mr. Speaker, gives people hope, and it includes unprecedented investments, such as $5.1 billion for our hospitals, $2.6 billion to construct long-term care beds, $14 billion in capital grants for schools, $2.8 billion to build broadband. The member spoke about PSWs, and we know that long-term care has been top of mind for our government and, frankly, for everyone in this province that we call home. So my question is simple. Does the member support this budget and spending $125 million to support the accelerated training of close to 9,000 PSWs, including in her region at Durham College? Yes or no?
Thank you. Back to the member from Oshawa for final response.
Thank you. And in answer to her original question, if we're reading the same document, I think we're reading it differently. I'm reading for what's there and what isn't there. When we hear from our community members about long-term care, to the member's point, when we hear about our community members about education, to the member's point, the dollars that the government's investing, well, obviously you couldn't get away with investing nothing in education or investing in health or investing nothing in healthcare. But when the numbers don't keep up with inflation, when those investments don't meet the needs of what the hospitals are asking for, how do you see that as a celebratory announcement?
Thank you.
Thank you.